Hi guys, welcome back to my channel. If you are new here, my name is Dee. Sorry, frog in my throat. And I was diagnosed with grade 2 triple positive breast cancer in December 2023. So from this title of the video, I'm basically just going to be detailing what my treatment plan is at the moment. I've done quite a few vlogs, and obviously the vlogs are showing me going through my treatments, but I don't think I've really explained what those treatments are and how long they're going to last for. And I suppose if you're watching them, it kind of would be great to have that kind of understanding. So I thought I would do this video just kind of detailing what my treatments are, how long they'll last for, and yeah, just kind of give you a bit more back information, so kind of when you're watching the vlogs you kind of understand, you know, what's going on. So just to put it in perspective, I had my therapeutic mammoplasty to remove the tumor back in March of 2023, and I was told in, I think, early April, that they had removed the tumor, and the extra tissue that they have, like a margin, they have to remove around the tumor to make sure that the margins are clear and that the cancer hasn't spread beyond what they think it's spread beyond. And I also had 2 of my lymph nodes removed, and my lymph nodes showed no signs of cancer, which is a great sign. And the tissue that was removed showed that there was no cancer on the margins, which is also another great sign. So that's where we are with that right now. So the treatment that I'm having is basically called adjuvant treatment, and that is to kind of just make sure that the chemo and the treatments kill off any remaining cancer cells that may be floating around in my body, and also to kind of target the factors that caused the cancer to start to grow in the first place. And I'll kind of go into a little bit more detail about that. Because I'm triple positive, it means that my cancer was being fed by my estrogen, my progesterone, and a protein called HER2. So because of that, my treatment plan is targeted therapy, chemotherapy, radiotherapy, and also hormone suppression. So firstly, as I said, because I'm doing it after my tumor has been removed, the treatment plan is slightly different. So my chemo is called paclitaxel. I take that every week, and that is for 4 cycles. Now 4 cycles consist of 3 weeks, so that would be 12 weeks. So I've just completed my first cycle and I have 3 more to go. So we're yay with that. The paclitaxel is basically used to treat kind of different cancers. It's used to treat ovarian cancer, breast cancer, and non-small cell lung cancer, and can sometimes be used also to treat other cancers such as stomach cancers. So as I said, I take that every week through my PICC line. So it's via IV, and I take that every week, and as I said, for 12 weeks. Alongside the paclitaxel, I'm also taking a targeted therapy drug called Herceptin, which is basically used to target the HER2 protein, or receptors should I say, on the surface of the cancer cells, and to basically target those receptors and stop the cancer from growing in regards to that factor, if that makes sense. And I take that as an injection once every 3 weeks, and that will be for a full year. I'll be taking that. So even after I finish the chemo, I will continue on with the Herceptin for another, let me do the maths, 40 weeks I think it works out to be. I think that's correct. So I worked out it would be around 18 cycles. So far I've had one. This Thursday coming, because I will be starting a new cycle, I will be also having my chemo and my Herceptin at the same time. Now, I did find on my first cycle that having the two together was very, very rough, and I just think my body was just like, what the hell is going on? This is a lot, but it is what it is. It has to be done. So that is where we are now. Once I have completed the chemo, I will then probably have a little bit of a break just to make sure my body is kind of adjusted, and then we will start radiotherapy. Now, I haven't been told how long my radiotherapy will last and how many sessions I will have. I think my oncologist kind of just wanted to kind of get my chemo started and get through that first before she kind of shocked me and gave me too much information, because obviously your first oncology appointment when you go to discuss your treatment plan can be quite overwhelming. You're taking a lot of information in, you're having to sign the documents to say, you are aware of all the side effects and all the rest of it. So I think she was kind of like, let's just get the chemo done and then we will move on to what radiotherapy will be. Once I've had my radiotherapy, I then will also have to have another surgery on the right side to reduce the right side to match the left side. So there's that, and then I believe after that I will then be put onto what they will call hormone suppression tablets, which I'll be on, I've been told, for 5 years. So that is where we are in terms of the treatment plan. Like I said, I have completed my cycle 1, so I have 3 more cycles of the chemo to go, and then it will basically be, after that, just mean the Herceptin for the remainder of the next year. So I started on the 16th of May, so my Herceptin will run until next May 2025, and I believe I'm assuming in terms of the timeline, it probably won't be until the end of the year until I start my suppression tablets. It may be earlier than that, I'm not entirely sure. But I kind of just wanted to make this video because I feel like I was talking about these, the chemo and the Herceptin, and I don't think I really addressed what each treatment or which drug was for what. So I think it kind of makes sense now that my chemo or paclitaxel is to kind of target the cancer cells, and the Herceptin is to target the HER2 receptors on the cells to kind of stop the cancer from coming back. That is the hope. The Herceptin is what they call a targeted therapy, so it's targeted because it's targeting a particular receptor, which kind of makes sense, and I was kind of told that very, very early on when I was diagnosed, that would be the route that we would be going down. So yeah, I don't think that there's anything else to add. I hope that makes it a little bit clearer now watching the videos going forward, and I will be doing some more videos like this. This is really off the cuff, last minute I decided to film this, so I hope I've kind of made sense and it kind of explained myself. But obviously if you have any questions, like I said, or you've been recently diagnosed and your oncologist is talking about these kind of medications and you kind of want to know what's it like, obviously you can watch the vlogs, because I do a vlog to kind of say, this is how I'm feeling, this is what the side effects I'm feeling today, so you can watch that. But if you have any kind of questions, obviously leave those in the comment section down below and I'll get to those questions as soon as possible. I will be doing some more information and things I've found, things that are important to look out, but those will be videos that are coming up as the weeks come along. Obviously, bear with me. I'm trying to film these in around the times when I'm not feeling great, and I don't want the channel to be just vlogs all the time. I do want there to be some kind of information and some help, because I did find for myself quite limited information, and sometimes it's kind of nice to, you know, hear somebody's perspective on something and it not come as feel very rehearsed, in the sense of like, I'm making a video and this seems very rehearsed. I want it to kind of come across as natural and relatable. That's how I look at it. So yeah, I hope you enjoyed this channel. If you've got to the end of this channel and you've watched it all to the end, I thank you so much. Leave me a pink heart in the comment section so that I know you've watched it to the end. I would really appreciate that, because that tells me who's watching to the end, if that makes sense. But yeah guys, I will see you in the next video. Take care of yourself. As always, peace.